Good afternoon. I'm Cathy McMorris Rodgers from Washington State. And today in America, there's widespread agreement among both pro-choice and pro-life Americans that taxpayer funding should not be used to fund abortions. Since the Hyde Amendment was passed in Congress in 1976, the use of taxpayer dollars has been prohibited. And Americans believe that it is wrong for taxpayer dollars to pay for something we consider immoral. And this is an area that really reaches across the ideological spectrum. And yet the Senate health care bill would reverse 30 years of federal policy and overturn the wishes of two-thirds of American women by forcing all taxpayers to fund abortions. And I'm concerned that the Senate health care bill will end up being the law of the land, despite the efforts of some pro-life Democrats. After all, it was the Senate Democrats who removed the Stupak language from the Senate health care bill, even though they realized that it would make passing the health care bill much harder. Just recently, Congressman Stupak did an interview with National Review, and he was talking about all the lobbying to try to get him to support the health care bill. And one member told him, he said, if you pass the Stupak Amendment, more children will be born, and therefore it will cost us millions of dollars. Is that how we value life in America? As a mom whose son has Down syndrome, I find these words to be especially chilling. Our health care policy should not be used to encourage women to have fewer children in order to save government money. The impact of thinking this, especially the impact it would have on children with special needs, is really horrible to imagine. At this point, the only way to ensure that taxpayer funding is not used for abortions is to stop this bill. That's what the American people want, and that's precisely what we should do.